Got it. So now we heard two points of views here from Dr. Sujata and from Dr. Sonal, and Dr. Amitav has all the numbers with him. And but still, I think we are, if all of the panel agrees, we still have to do more. Still has to be more data for the side effect profile. I think that is what we are missing. Am I right, panelists? Yeah,
It's
right.
a benefit also because any highest body or any highest authority says something, he or she opinion doesn't count as evidence. The data should be in the public domain. And as you said, deaths and other things, it is the general yet to policymakers and the farmer to put it as coincidental. Like if there is one death in 800, that is the death from COVID vaccine which has come out. A clinician does not see 800 patients. He sees 799 patients, he will see no deaths, no side effects. But one death in 800 is one too many. In a country of 1 crore, 100 crore, if you give, there will be about 10 lakhs deaths. So it gets diluted at the population level. So the population level figures, monitoring and surveillance, and that's why adverse event reporting by an independent body is very important. It is just like going for super fast trains. We are going super fast trains and old tracks are there. You require new tracks. Derailments are there at the remote areas. Nobody is noticing the casualties. So until unless you have a proper health infrastructure equitably distributed, you are not going to catch the adverse events. You are not going to catch. You are just going to push the super fast trains on old rickety tracks. So that is what we are going to do. That's why I said you can't push it in the national program where we don't have the public health infrastructure. Let anyone take it on her cost or his cost. Let it be in the market. Then we have a long-term safety here rather than going all out.
Okay, I think everybody's got the takeaways from this panel. I think it's a very, very good discussion that we had. And I think the takeaway is that we know the age of vaccine. We know that there are side effects. We know that the holistic treatment also should be involved. I forgot to mention ozone therapy in my talk, actually. Ozone therapy can be very beneficial adjuvant therapy when a patient has developed cervical cancer. So with this, I would like to conclude, and the team leaders can over there, Dr. Ruhi, you can ask the general Q&As.
Yes. So thank you so much. I think it was a very exciting conversation. So I'll take up a few questions. So I see a lot of concerns in the chat that okay, now should we go ahead and vaccinate our girls or not? So I think Dr. Huda, you already asked that.
Yeah, I did. So I think we do have conflicting views on this, but I think on the whole, if we are creating herd immunity, my take would be to go ahead for the vaccine. That is my take, very personal, not to be. Yeah, for herd immunity, I like that particular thing that's really touched me. That yeah, herd immunity.
I have another comment from Dr. Vivek Kadambi here. In the attempt to improve herd immunity, we are in many cases increasing the number of carriers. That's even more dangerous.
Dr. Sonal, would you like?
No, not increasing the number of carriers. We are just instigating immunogenicity. Immunity will develop.
Okay.
And
that's for all vaccines, no?
yeah, it happens with all the vaccines. Why are you taking flu vaccine now? Because you know that it provides protection over a time.
There is always going to be a world of vaccinators and non-vaccinators. There will always be that. And I think we can never come to the full and final decision, Dr. Ruhi. I think so. I think this is a question we should.
Vaccine also, but polio now see polio has almost gone away. So I think this vaccine will also do wonders. And if it has come to single dose, I think it should be given.
Dr. Mittal, Dr. Banerjee, do you want to add to this?
Polio
Yes,
had only few strains. Here we have got 200 strains. So
yes,
polio
that's what I
vaccine
was
was
going to say.
efficacious. Here we don't know. We don't have the trial has never been completed for the end stage. And herd immunity, I am first time hearing in HPV herd immunity. In COVID, we never accepted herd immunity, which is a homogeneously spread. Herd immunity affects in sexually transmitted diseases. These models do not work because there are some very high risk groups who indulge in very high risk behavior. It's a very heterogeneous. That's why I said if you want to try out the vaccine, first try it out in the high risk group among the commercial sex workers and the general population. The outcome will be so less, you will not get any definitive answers. And it will be just promotion, promotion. Film stars will promote, cricketers will promote, and pharma will promote. So evidence has to be collected where the outcome is more like high risk groups. So here the herd immunity doesn't follow the pattern as in other communicable diseases.
Very
And
good.
one more thing,
Very good.
and one more thing I just want to say is already the studies are showing that after giving the vaccine, the replacement means other vaccines, other type of the HPV infection, high risk, they get replaced. For example, it's just simple to understand. Suppose we give the antibiotics for a prolonged time, fungus infection occurs in the body. So similarly here, if you because vaccine is not containing all the high risk type, vaccine is against only 7. And now the studies are saying that 10 more high risks are going to be identified. Study by the HALEC has shown that 10 more are going to be identified. So it get replaced by the other some other oncologic HPV types also. So I don't understand what is the herd immunity when the more than 200 types of the HPV infections are present.
Yeah, to that, Dr. Sonal, please add something. And I can't hear you.
See, diseases will keep on coming. You can't stop the diseases from coming. If one virus has, now we know that this virus is carcinogenic. We are working against it. Other viruses will definitely come. You can't stop the viruses from coming in. They will definitely come.
So
And
we will have to take a vaccine every day then. 100
That's
viruses we have to take. I mean, we have to just make some priorities, no? Like if the 100 viruses come, we will take a vaccine every day. I mean, there has to be some, and there everybody will find a new virus every day.
so
So there
it
is,
is
we
better
have to be,
in
I think
functional
we should
medicine
go functional
conferences.
medicine way, prevent it, screen it,
Yeah.
and just
yeah,
change our
then
life.
Increase the live the
final
way the
final
live the
common pathway is safe sex. Final common pathway is safe sex. Actually, and it has come down in last 3 decades. You see the number, it has come down. You know, you have a rotavirus vaccine, doesn't even still 2000 children die daily from diarrhea. Rotavirus did not prevent diarrheal deaths. Similarly, we have a vaccine for hepatitis B. It doesn't prevent so much as we expected. It did not eliminate cancer, liver cancer. So it's a promise which is not worked. Polio is a communicable disease. This is a, we are trying to use the same year in a non-communicable disease which we don't know whether it will work or it will not work. There are so many factors for cervical cancers. How much is attributed to HPV, we don't know. As Dr. Mittal said, some percentage, 2%, 10% out of so many million. So still the bulk of cervical cancer, and many people will be lulled into complacency. They will not go for cervical cancer screening. As it is today, people are not going. So it will create so many wrong messages.
the WHO is 70, 90, 70, 90. I mean, they are too.
WHO, I am not having any faith in WHO as on today.
You have to screen. You have to
You
vaccinate.
cannot, we are science. We are not, he is not the Pope. In religion, there is a Pope, there is a Sankaracharya. Here we are talking of science. In science, when it goes towards certainty, it is going towards faith. It is going away from science. Be it WHO, be it anyone.
Yeah, and if we
I
are
think
talking about hepatitis B, we all doctors are taking hepatitis B when we know that we cannot prevent it completely. But
I think it varies from vaccine to vaccine. That's what
No,
Dr.
that
yes.
I am not against HPV vaccine also. I am against it being used in the government program under the taxpayers' money. It is not a health economics when the outcomes are uncertain. So
the,
let people take it on their own choice. Let doctors take it. Let anyone take it.
yeah,
So just to add, Dr. Mittal said, there I think there is enough data on how the immune system dysregulation can also happen post vaccination, and we also in functional medicine, where we handle a lot of autoimmune condition, we see how many of these autoimmune conditions have been triggered post-vax.
They get triggered by vaccination. That is true, Dr. Rohi. That is true.
So I think anyone who is keen to take, the cervical vaccine or be it any other vaccine, please
I
do.
think let's push for screening.
Yeah, please do a lot of reading yourself. Take an informed decision. I think we had amazing panelists to share their insights on this topic that is around the country. So yeah, take an informed decision. There is enough data out there on both aspects, and yes.
One thing I would like to add, 2 screens are important for every sexually active woman in her
Yes,
life between 35 to 50 years, and preferably it should be HPV.
Okay,
Yes.
this is agreed to.
Yeah. Don't go for
unanimous agreement. Yeah.
But still,
Screening.
see again, if we go to the, as you were saying, mid district and villages, this testing is not available. Even the
Yeah, yeah.
cytologist
That we
doesn't
should
available. So
concentrate
we
on that
need to
first.
focus more on the pap smear or LBC at the village and the district level. It
have
is a
to go.
costly test.
3 things have to go hand in
We're
hand.
not here to discuss about Delhi alone or the metropolis. We are here to pan India. So at pan India, again, pap smear and LBC is the way forward, at least in the beginning. I
Ma'am,
have taught
says
MSMD doctors to do the pap smear at district level. Albert, MSMD, they don't know how to do the pap smear even. So I have taught them to do a pap smear. So again, we have to see a lot of things. The way the education level is going down, the way the money is being think as all and more pervasive thing. So HPV for the metropolis and the way facilities are available, yes, no doubt about that.
No, but screening for HPV, that is where the money should be. Right. Time is up. Time is up.
Rather
Yes.
cervical cancer, screening for cervical cancer. Forget about HPV, screening for pap smear. Forget about HPV as well. Lot of
Should we not
uncertainties.
do? No, but pap smear we are doing, but also we should be doing HPV screening with it, no?
HPV screening has to be done, sir, so that high risk group can be, diagnosed.
No. There are so many fallacies in that, but definitely because science is saying that cervical cancer cannot occur without HPV. We are doing it, but HPV test doesn't indicate active, persistent, or the transforming infection. It just indicates that the virus is present in the body.
I'm sorry to interrupt. We
Okay.
we've already
Yes,
over time,
yes.
so I'll
Yeah.
have to ask you to pause here. But I'm sure if we can manage some time later or tomorrow, I think it's an amazing discussion to continue. Thank you so much, everyone.
Thank you.
Thank you. It's a
Thank you.
pleasure.
Thank you,
For
Namaskar.
Thank you very much.